Yeah, hi, good afternoon everybody. This is Dr. Chenna Keshava. I'm from India, and this presentation is about an atypical manifestation of duodenal carcinoid. Carcinoids generally are known to present with one second. Carcinoids are a heterogeneous group of relatively rare neoplasms which arise from the diffuse endocrine system.
The slide. Hello, Keshav. Move the slides, please.
Yes.
Shift the slides.
Yeah.
You have the control. Yes, that's right.
Carcinoids are a heterogeneous group of relatively rare neoplasms which arise from the neuroendocrine system cells, which are believed to come from the neural crest cells, from the embryonic neural crest cells. They metastasize. In the majority of them metastasize and present. The metastasis presents with manifestations, and most of the metastasis have a highlight on a CT or an MRI with contrast. Whereas the cystic hepatic metastasis of the carcinoid is a rare entity, and there have been only a few reports, and around 4 from 1987 to 2016, and all have been in relation to an ideal lesions. So this makes a very rare entity, a duodenal carcinoid presenting with cystic hepatic mets. And manifestations wise, carcinoid usually presents with the classical triad of carcinoid triad is diarrhea, flushing, and pleuritis, with severe tricuspid regurgitation. This was a 66-year-old male who got admitted with a history of progressive fatigability, progressive bilateral lower limb swelling, decreased appetite for 15 days. He denied history of diarrhea, vomiting, melena, hematochezia. He was not a known diabetic, hypertension, had no cardiac problems. On examination, he had bilateral pitting edema. He was pale. He had a raised JVP with a pansystolic murmur at the tricuspid area, and he had bronchi over the chest and tender right hypochondrium. Workup revealed hemoglobin was 4.3 and a peripheral blood smear which showed microcytic hypochromic anemia. So, and 2D echo revealed a dilated right atrium, right ventricle, and a severe TR with pulmonary artery systolic pressure of 70 mm mercury, and left ventricular ejection fraction 56%, and there is no regional motion abnormalities, and there was mild MR and AR. OGD done in view of the severe anemia workup showed multiple duodenal nodules, with largest nodule measuring 2 into 3 centimeters, and was biopsied for histopathological examination. A CECT of the thorax and abdomen revealed enlarged liver up to 15.55 centimeters and two well-defined cystic lesions in the segments 4A of the liver, which were measured about 36 into 31 into 32 millimeters and 8 into 9 into 4 millimeters, with pyloric and duodenal wall thickening, suggesting a neoplastic etiology. The same slide. So HPE showed grade 1 neuroendocrine tumor. Carcinoids, the earlier terminology was carcinoid, but now it's being referred to as NETs or neuroendocrine tumors. The classical, the diagnostic marker for NETs is chromogranin positivity and synaptophysin positivity. If synaptophysin and chromogranin are positive, that confirms NETs. Patient had synaptophysin positivity plus chromogranin was positive, and the Ki-67 index, which is done to find out the mitotic severity or mitotic index of the tumor, was less than 2%, which suggested it to be a mild case of carcinoid, mild or a low grade carcinoid. So based on this is the WHO 2000 classification of carcinoid, which showed this patient's Ki index was 67%. Ki index was less than 3%, which put it under the well differentiated the low grade carcinoid. Patient was transfused with blood and was symptomatically better. In view of the low grade tumor, patient was discharged home for an advice for regular follow-up. In brief about carcinoids. Carcinoids or NETs are a heterogeneous group of relatively rare neoplasms arising from the diffuse neuroendocrine system. They can arise anywhere in the body, but most common site is a GIT. There are different reports which suggest different sites as the most common cause. The earlier reports used to say it was ileocecal area was the most common site of carcinoid, and if you look at books which are more than 20 years old, they say appendix was the most common cause. But of late, it is believed that rectum is the most common site. It's probably because the increased frequency of colonoscopies and Investigations. More common among females, age is generally 5th to the 7th decade. NETs, the peculiarity of NETs is they secrete multiple vasoactive substances, prominently 5-hydroxytryptamine, which is serotonin, which are generally inactivated by liver and kept under control. But when the production exceeds the capacity for degradation, that is when they metastasize, they present with a classical carcinoid syndrome, which is seen only in 10 to 15% of all the carcinoids. The triad of carcinoid is cutaneous flushing, bronchospasm and wheezing, which is seen only in 1/3 of the carcinoid. Most patients, which is approximately 50% with neuroendocrine tumors, have metastatic disease at diagnosis. Duodenal tumor less than 1 cm rarely metastases, whereas 33% of those greater than 2 cm do. Our patient had a tumor of nearly 2 to 3 cm. And liver metastasis usually solid and extremely vascular and are accentuated with contrast. Our patient had a cystic appearance. Cystic appearance is exceedingly rare in untreated duodenal NETs. Cystic changes due to central tumor necrosis are described in hepatic metastasis after chemotherapy. Conclusion. In conclusion, carcinoid, known for its varied presentation, can be confusing, but a very high index of suspicion with early HPE helps in confirming the diagnosis and early plan of care. Based on this report, we can safely conclude carcinoid should be considered in the differential diagnosis for all anemias and atypical manifestations. These are my references. Thank you.